York State has released some pretty startling statistics. They say that more than half of people who were hospitalized with COVID-19 acquired the disease while also complying with those social distancing lockdown restrictions. So emergency room doctor, chief medical officer of Remote Health Solutions, John Bowe is here, or rather Dr. John Bowe is here with us now to talk about that. And I also want to ask you about something else, Doctor. Mayor Bill de Blasio just announced earlier this morning that antibody testing would be available to everyone in New York City who wants it for free. But as I understand it, there's a certain amount of controversy when it comes to antibody testing. There are a number of different antibodies. We really don't know what it means, really, if you show that you have the antibodies in your system other than you were exposed to the disease. So could this maybe offer a false sense of security? Or, maybe it's a great thing and it's part of the next step that we need when it comes to opening up the economies?
Yeah, thanks for having me on. There's a couple of great questions that you bring up there, and one has to do with the social distancing question that you bring up, and what did that really mean as far as having people that were social distancing, that were at home, and still contracted the disease. And there's a lot that we're going to figure out about this. And one thing that we do know is that this virus is different than a lot of viruses. It's much more contagious and it's much more virulent than most of the viruses that we deal with. And so the study actually talked about the fact that these patients or these individuals were not leaving their home on a daily basis. So we're going to have to sort of dig into this data and figure out, were they leaving occasionally? Were they heading out? Were they continuing to have some social interaction and some exposure in their lives? And it just wasn't on a daily basis. We're going to have to figure that out. We're going to have to dig down into it, because I think each and every one of us are concerned about that. I look at my own situation. I'm a father. I'm an individual. I'm a citizen. I'm an ER physician, and I'm a telemedicine guy. And so each of those brings to me a different exposure and a different perspective as I deal with how do I keep myself safe, and how do I keep my kids safe? How do I keep my neighbors safe, and the citizens in my community and across the nation that I deal with as patients? And we just don't know yet, and that's the truth. I wish I had a better answer there, but we're going to continue to figure this out. This idea of social distancing really is new, and it's something that we haven't really dealt with before. The data behind it seems pretty good, and the science we're going to continue to figure out. Now the question about the antibody testing. From everything I can read, the antibody testing that has been approved through the FDA is good. High sensitivity, high specificity, meaning it's valuable tools, it's valuable data. And when we're testing for these IgG and IgM antibodies, that is really, I believe, very strongly going to be the thing that helps us to know when we reach that herd immunity. When can we identify that the population has had enough exposure that it won't easily spread throughout the community? And those are the things that we need to know. When is it going to be normal? When is it going to be safe to go back into community the way it was before? And I think that needs to be done regionally and geographically. There's a lot we can talk about there too.
Dr. Bowe, you mentioned your physical safety as a physician treating people who have potentially been infected with COVID-19. In recent weeks, we've been seeing a lot of different accounts from healthcare workers across the United States saying that they feel defeated after their shifts. So we're now talking about the mental health of medical professionals, because they say that they are confronted often with conspiracy theories around COVID-19. In fact, there's new polling out that shows that people, depending on your ideological political spectrum, you have a very different understanding and a different take on what this pandemic means, and the numbers and the statistics and the evidence, the scientific evidence that's being reported. I actually interviewed a medical school professor, and I asked her what it must be like graduating from medical school right now into a full-blown pandemic, and then having to deal with people who don't actually believe in the science, which is what you are trained to do. How do you handle the spread of misinformation, and how do you keep mentally fit when you know all this is swirling around you?
Yeah. It is very true, not only at work, but in social media and in my own family, those conspiracy theories come out. I know that my uncle posted something about, he thought this was a conspiracy. And my mom quickly posted back, "Hey, listen, John says it's real. It's enough said for her." And I think that that is one of the things that as healthcare professionals, that is a hard conversation to have with people. And it would be hard if you didn't have any additional exposure than what you're in, especially if you're in a rural area like where I live in very southern Utah, where the cases are small and the impact is not great. If instead you have the experience and you have the exposure and you have those individuals that you rely on. For instance, I have a lot of friends in New York on the East Coast, and I talk to them frequently, and they are in a war zone. They're in a battle every day. And so those things really help me to remember and teach others that this is a real disease, and this is in certain areas very, very dramatic and unlike anything we've really faced before. And it's a new environment for us. How do we deal with this on such a grand scale, and were the quarantine and isolation requirements necessary? It's all so new and such a amazingly different environment for all of us. I'm just happy and I'm proud of the majority of the country that was able to band together and say, hey, let's do this to be able to keep people safe.
Really good advice there, and I'm glad to know that you are able to find that thread or thread that needle when it comes to dealing with some of the misinformation that's out there swirling about you. Dr. Bowe, thank you very much.
Thank you. Appreciate it, guys.